Hi, my name is Pallavi Kapilavaih, and my project is on the remote loading of gas bubbles into polymeric microcapsules for ultrasound-guided drug delivery. Conventional chemotherapeutic drugs used for the treatment of cancer show poor tissue specificity and are constrained by dose-limiting toxicity, thus necessitating the design of intelligent targeted drug delivery modalities to overcome these challenges and increase drug efficacies. The past few decades have seen considerable advances in the utilization of polymer-based microcarrier systems to overcome these obstacles and increase drug efficacies. Polymeric microcapsules have the ability to address the need for specific targeting and have extensive biomedical potential in drug delivery and in vivo imaging. Microcapsules are aqueous reservoirs enveloped by a polymeric shell, making them suitable for distributing both hydrophobic and hydrophilic drugs. Advantages like ease of manufacturing, high loading capacities, and defense against seepage of the encapsulated drug make microcapsules a promising technique for targeted drug delivery. The ability to load a variety of contrast agents into the core of microcapsules renders them beneficial as dual contrast enhancing agents as well. Microcapsules can be made ultrasound sensitive by the introduction of gas bubbles into their core, thereby improving their potential as theranostic ultrasound contrast agents. Gas microbubbles filled usually with air or perfluorocarbon are documented ultrasound contrast agents that show volumetric oscillation upon exposure to sound energy. With an aim to combine the therapeutic and bioimaging applications of polymer-based systems, our study successfully devised a novel one-step approach of remotely loading gas bubbles into polylactic acid-based microcapsules with an aqueous core, making them acoustically active. From our observation, suspension of microcapsules in a solution with high amounts of glycerol and propylene glycol changes gas solubility, thereby inducing bubble nucleation within the core of the microcapsules. We were also able to successfully demonstrate that drug loaded into the core of the microcapsules following a nucleation event is retained at significant volumes, and that the loaded microcapsules are acoustically active and capable of responding to focused ultrasound. An increase in the number of gas-nucleated vesicles was observed, with increasing concentrations of propylene glycol and glycerol. The average concentration of the acoustic vesicles generated with this method was comparable to conventional but more complicated methods such as freeze-drying. The retention of small molecules in the core of the microcapsule following a nucleation event was also tested. To achieve this, calcine, a widely used surrogate drug due to its fluorescent and auto-quenching properties, was loaded into the acoustic vesicle. Significant calcine fluorescent intensity following extraction was noted, which is indicative of the successful loading of calcine into the acoustic vesicle. By the same process, a range of drugs or contrast agents can be loaded for therapeutic interventions and imaging applications. Based on confocal microscopy, the calcine accumulates in a single region or cap of the acoustic vessels. This resulting distribution of calcine creates a Janus-like particle that is unique compared to other acoustic vesicles. Another characteristic of the microcapsules that was investigated was their response to ultrasound. An increase in acoustic vesicles' stable cavitation dose was noted by increasing the ultrasound pressure applied. This indicates the ability to make polylactic acid vesicles responsive to ultrasound simply by adding them to propylene glycol and glycerol without the need for additional steps such as centrifugation. However, somewhat limited release of loaded calcine was observed when the microcapsules were exposed to ultrasound. The present study introduces a new method of formulating acoustic vesicles as biphasic Janus particles that can contain high volumes of both bioactive therapeutic agents and gas bubbles in the core. This method of generating acoustic vesicles from microcapsules could have wide implications in systemic drug delivery, implantable drug delivery systems, and the generation of porogens for tissue engineering scaffolds. Future studies would focus on enhancing drug release by embedding gold nanoparticles into the shells of the microcapsules.